Only 12 days away now from the free 7 News Health and Fitness Expo. Have something for you here. Rock climbing and hip replacement surgery. You wouldn't think the two go together.
Not at all, but that is definitely changing thanks to a new procedure at the Kaplan Joint Center at Newton-Wellesley Hospital. 7's Amanda Grace has the story.
Am I on belay?
56-year-old Day Atchison started rock climbing in his early 20s, and he was hooked.
That's a good hold. I like that one.
By 35, he started to notice his hips were beginning to cause him some trouble.
For some reason, they chose to wear out a little bit earlier than they were meant to.
He was diagnosed with osteoarthritis and suffered for years. Day knew without surgery he'd have to give up rock climbing for good, but he feared the long-term problems often associated with hip surgery.
Where's that handhold?
But for Day, it was a good day. Doctors at the Kaplan Joint Center at Newton-Wellesley Hospital told him he was a candidate for a mini hip.
It's especially good for the young active patient.
The mini hip is designed to preserve a patient's bone and overcome the limitations of both hip resurfacing and standard hip implants. Dr. Dan Snyder explains how most hip surgery involves going in through the patient's side or the back side. But for Day, he went in through the front.
To do the direct anterior approach is new and different. You don't cut any muscle at all, and therefore the restrictions are zero.
That was music to Day's ears.
I love the idea of the direct anterior approach because it didn't cut any muscles, which meant the rehab would be faster. It meant that the dislocation would be basically non-existent from day one.
Just weeks after surgery, Day saw a huge improvement.
After 3 or 4 weeks, I was realizing that I was off my cane, I was riding bicycles, I was riding my motorcycle. I was back at the climbing gym at 5 weeks, and it was just getting better and better.
For Day, his new hip is like a new life.
Okay, it's feeling good.
Amanda Grace, 7 News.